A warm good morning to everyone. I am Malathi, Assistant Professor in ES College of Nursing. Today we will see about the hydrocephalus. First, what is meant by hydrocephalus? In the sense, you have to term hydrocephalus is derived from the Greek word hydro meaning the water and cephalus meaning the head. The accumulation of fluid in the head is called as the hydrocephalus. Not only the fluid, you have to come under by the CSF fluid accumulation. It is an excessive accumulation of fluid in the brain is have to called as a hydrocephalus. It is not a disease but drives a group of condition. Next we will move on to the hydrocephalus, how they has to formulated. In this you have to see in this image, you have to come under by the normal brain and you have to brain with the hydrocephalus. How to normally ventricles have to accumulated by the 20 to 50 ml of CSF fluid have daily have to accumulated. In this normal brain capacity has seen in this first image. And second image you have to see by this ventricles filled with the extra fluids. The extra fluids in the sense have to accumulation of fluid have to excessive. They may have to large blood from the enlargement of head. That is comes under by brain with hydrocephalus. In this incident, mainly have to 1000 live birth, 3 to 4 child may have to affected by the hydrocephalus. In this hydrocephalus may have to define in this congenital may be due to maldevelopment and intrauterine infection, and acquired may be due to the infection of neoplasm and hemorrhage. This is the main incident rate of the baby have developed by the hydrocephalus. It is not only by the baby children's period, you have to develop by the older period also have to develop by the hydrocephalus. In this overview of CSF production, how the CSF fluid has to produced in the sense, you have to hold the approximated 20 to 50 ml of CSF fluid in the ventricles. The ventricle has have to hold the approximated fluid volume of in this 20 to 50 ml. In the CSF is produced in the choroid plexus at a daily rate is 14 to 36 ml per hour have to choroid plexus has produced by the CSF fluid. The choroid plexus or the sources of approximately 80% of CSF fluid may be have to source of approximated the blood vessels in the subendymal region and also contribute to the formation of the CSF. The majority of CSF produced from within the two lateral ventricle, it is a CSF passage through the interventricular foramen or Menaro to the third ventricle, then the cerebral adequate to the fourth ventricle. This is the main majority of production of CSF fluid within the lateral ventricle. In this fourth ventricle is an outpouching on the posterior part of the brainstem. From the fourth ventricle, the fluid passes through the three foramen entire the subarachnoid space. It passes through the foramen are mesenteric on the middle and two foramen of the lucus lateral. The subarachnoid space cover the brain and spinal cord. The main cause of hydrocephalus comes under by the adequate stenosis, mehallic inclusion disease and rubella cevicis. The obstruction of foramen and magnetics Dandy-Walker malformation and meningocele may caused by the babies have developed by the hydrocephalus. Or other causes may have to baby develop by the severe headache, congenital impairment, gait disturbances and urinary incontinence, visual changes and nausea and vomiting, sleep disturbances, seizure and decreased mobility. These are all the upcoming cause baby have developed by the hydrocephalus. The types of hydrocephalus in the sense, in this types we have to see about the 5. In this congenital hydrocephalus present at the birth and caused by the pregnancy complication or genetic disposition. Acquired hydrocephalus develop at the time of birth or later line. In this communicating hydrocephalus and obstructive hydrocephalus are otherwise known as non-communicative hydrocephalus. A normal pressure hydrocephalus or otherwise NPH hydrocephalus and Dandy-Walker malformation. Next we will see about the one by one. In this have to comes under hydrocephalus is communicating or non-communicating. In this communicating hydrocephalus may causing by the hemorrhage, if any type of infection may occur by the child, or traumatic injury or genetic disease may caused by the communicating hydrocephalus. The non-communicating hydrocephalus in the sense adequate stenosis, baby have developed by the any tumor in the brain or genetic cause may caused by the non-communicating hydrocephalus. In this, have the congenital hydrocephalus. The congenital hydrocephalus is have to formulated by the birth or otherwise genetic or failed to fetal growth or have to baby mother have to develop by the any type of infection during the antenatal period. The baby have go for the congenital hydrocephalus. It's mainly the mother have to affected by the infections such as rubella, syphilis and toxoplasmosis, mumps, spina bifida. Other abnormalities may caused by the congenital hydrocephalus. The mostly common category in the children's may have to develop by the congenital hydrocephalus, usually present in the infancy hydrocephalus presenting after the 6th month and less likely to the congenital or neoplasm must be excluded. An acquired hydrocephalus or non-communicating hydrocephalus. The acquired hydrocephalus usually affected the birth. Baby can affected by the birth injury, stroke or meningitis, brain tumor or head injury. If in case of baby have to develop by the any communicating disorder like blocked cyst fluid and following the ventricle and obstructed of hydrocephalus. Obstruction of the hydrocephalus fluid also may caused by the acquired hydrocephalus or non-communicating hydrocephalus. It is nothing but in the intraventricular obstruction may caused by the have developed by the tumor by the posterior fossa tumor or brainstem glaucoma, a tumor of penile body and choroid fluxus and papilloma and ependymoma and colloid cyst infections and cerebral abscess and ventriculitis and hemorrhage may have to develop by the acquired hydrocephalus or otherwise you have to call it as a non-communicating hydrocephalus. And the next one is communicating hydrocephalus. It is nothing but you have to block the CSF fluid. Other the neurological condition may develop the hydrocephalus or meningitis or subarachnoid hemorrhage may have to caused by the extraventricular obstruction by the infection of TB at subarachnoid hemorrhage or head injury may caused by the communicating the hydrocephalus. I have to come under by the before going to see about the diagnostic evaluation, some of the clinical manifestation has found by the hydrocephalus. Now unusually the baby has developed by the large head, increased in the head size and poor feeding, sleeplessness, spina bifida, vomiting and irritability, poor growth and poor responsive touch and eye that appears to the gauzy downwards. It have to come under by the child. In this toddler age group, the baby have developed by the headache, poor appetite, poor coordination and unstable balance and blood of vision, a double vision and urinary incontinence, excessive sleep, have to come under by the declined school performance, a changing in the personality and have to come under by the provide acquired skill, the cross eyes, poor temperature control. Have to older children may have to develop by the some of the signs and symptoms as memory loss, loss of thinking, or difficult to walking. These are all the main clinical manifestation have seen in the hydrocephalus. Mainly baby have to not coordinated with the other works and have to not approaching by the normal physical activity. This is the main signs and symptoms have seen by the hydrocephalus. Next we move on to the diagnostic evaluation. In this diagnostic evaluation you have to examine the infancy, maybe reveal the following findings. In this head enlargement, a disjunction of the suture and dilated scalp veins and tents of fontanelle and characteristics of increased intracranial pressure, the downward deviation of ocular globes and retractor upper lids and visible white sclera above the iris. In this, have to go for the other than that you have to check by the ultrasound scan and plain skull x-ray, CT scan and MRI. This is the main finding you have to assess by the babies is comes under by the hydrocephalus or you have to not by the hydrocephalus. After that you have to move on to the complication. In this complication you have to the severity of hydrocephalus depend on the time of onset and whether the disease is progressive. If the condition is well advanced at the birth, major brain damage and physical disability are likely. Other complication of hydrocephalus includes intellectual impairment, growth retardation and neurological damage such as decreased function, movement and sensation and have to come under by the poor appetite, have memory loss, loss of thinking, may have to difficult to walk is a main complication of hydrocephalus may have to develop. In this, you have to go on to the treatment. The treatment modality of hydrocephalus are excessive accumulation of fluid, in the sense mainly you have to go minimize or prevent the brain damage by improving the CSF flow. If in case of the CSF flow has to obstruction, the CSF flow has to reduce, in the sense may have to develop by the enlargement of the head. In this enlargement of the head, you have to decreased by this CSF fluid flow. The decreased, or you have to maintain the brain damage by improving the CS flow. In the surgical intervention or the primary treatment, including the direct removal of the obstruction, if possible, a surgical shunt within the brain may allow the CSF to bypass the obstructed area if the obstruction cannot be removed. In this, basic therapy you have to provide. In this, if in case of failed to CSF fluid corrected surgery, in the sense you have to maintain the airway breathing and circulation, head position, you have to maintain the temperature and blood pressure control, and seizure control you have to manage, and fluid and steroid and iodine you have to provide, and osmotherapy and extra stimuli has to provided by the baby of hydrocephalus. In this, both the congenital or acquired hydrocephalus will be treated with either the shunt surgery or neuroendoscopy. The shunt surgery, in the sense nothing but it is a shunt surgery involve the implanting the thin tube called the shunt in this brain. You have to implant the thin tube by the brain is called as the shunt surgery. The excess cerebrospinal fluid is the brain run through the shunt to another part of the body. In this, usually the abdomen, from here the fluid is absorbed into your blood stem. The shunt has a valve inside to control the flow of CSF and ensure it does not draining too quickly. The shunt, once you have to introduce into the ventricles, in the sense they have to usually maintaining the flow of CSS have to drain quickly by the extra CSF fluid. In this, you have to come under by the shunt method. In this, ventricular-peritoneal shunt and ventricular-atrial shunt. In this ventricular-peritoneal shunt, used most commonly the lateral ventricles is the usual proximal location. The advantages of this shunt is that is need to lengthen the catheter with growth may be obviated by using a long peritoneal catheter. The image have to seen by the VP shunt, the ventricular peritoneal shunt. The catheter has to introduced by the ventricle. The ventricle have to go for the observing the CSF fluid. After observing the CSF fluid, have to go for this tubing of abdominal cavity. The shunt have to produced by the catheter. The catheter has comes under by the which proximal location. That is, shunt is used most commonly the lateral ventricle is the usual proximal location. The advantages of this shunt is the need to lengthen the catheter with growth may be obviated by the long peritoneal catheter has to produced by the ventricle to abdominal cavity. The ventricular-atrial shunt is also called as the vascular shunt. It is shunt as the cerebral ventricles through the jugular vein and superior vena cava into the right cardiac atrium. The shunt has to come under by the through the jugular vein to tubing of the heart by the catheter has to inserted. The CSF fluid has to drained by the atrial. That is, it comes under ventricular-atrial shunt has to produced by this from the jugular vein to has comes under by the superior vena cava. It is used when the patient has abdominal abnormalities, that is peritonitis, morbid obesity. After extensive abdominal surgery, the shunt is require repeated lengthening in a growing the child. The lump operational shunt is used only for communicating hydrocephalus and CSF fistula and pseudotumor cerebri. And next one has comes under by the shunt is ventricular pleural shunt. They have to comes under by the trochal shunt is used to rarely you have to use it as shunt is ventricles to crystal space and the effective only in acquired obstructive hydrocephalus. The ventricular pleural shunt is considering the second line, it is used to other shunt types or contraindicated. Have to comes under by the ventricle to have to through the jugular vein to pulmonary cavity as produced by the shunt. Thank you for everyone